Okay, speaking of plastic surgery, this is a kind of interesting topic. I'm always trying to think of just like new things, interesting topics. And I was thinking the other day, because I was talking to a patient about, how great of a candidate they were for plastic surgery.
Yeah.
And I was like, oh, that's kind of interesting. Like, what makes a good plastic surgery candidate? And I was like, well, I can come up with, I think, 10 things that make a person a good plastic surgery candidate. And Sarah and Travis, I'm going to put you guys on the spot. You guys have to come up with one. I have 10. I bet you guys can come up with way more than that. But I bet you guys can come up with one. What do you think?
Healthy weight.
There you go. Perfect. That's a good one. Travis, you got anything? Did Sarah steal yours?
What about like non-smoker?
There you go. You guys are so good. Look at that. I knew you could do it. You guys are practically plastic surgeons yourself, but I hope you're not out there doing surgery.
We're going to open one up.
You guys are going to open up a clinic in Turkey?
We'll know how to evade the law now.
So,
in Florida.
But yeah, at this point, I've been doing plastic surgery in private practice for 15 years, and I do tons of surgery. So, I can definitely tell you that there are some candidates that are good candidates and some that are not as good candidates. So, you guys really hit the number one for me, which I think that one of the most important things for being a good plastic surgery candidate is to just overall be healthy. And you guys hit that. I mean, not being obese, which... I'll tell you, I've operated on people that are, pushing the limits with BMI because for whatever reason they just are not in a place where they can lose the weight, it does increase your risk when you are that heavy. But if people understand the risks, and I don't think that they're too extreme, I will operate on those people.
Yeah.
But after a lot of counseling. Not being obese, that's important. Not being a smoker, as Travis said.
Smoking messes up everything.
Yeah, nicotine is very bad for you in lots of different ways, but it's really bad if you're having surgery because, just so you know, which I bet you guys could tell me, I'm not going to put you on the spot, smoking or nicotine causes vasoconstriction, which means it clamps down your blood vessels. And a lot of these surgeries cause damage to the blood flow, the tissues, and then you're relying on that blood flow to allow for healing. And when you smoke or use nicotine, it clamps those down, and then you don't heal very well. So overall, being healthy just means not being obese, not being a smoker, not being diabetic, because diabetics also have healing issues. So being healthy. Next one is good mental health.
Yeah.
You have to be in a good mentally place to have plastic surgery. And so I have two things to kind of reflect on that. So first, having realistic expectations.
Yes.
And that's something I really kind of feel out on patients when they come in, to make sure that their expectations are realistic, because you don't want to do surgery.
Plastic surgery isn't perfect.
Yeah, I like to think that sometimes we get perfect results, but realistically, you can look at any plastic surgery and find little small stuff that would degrade it from being perfect.
We're all humans.
Yeah, and perfect is like subjective anyway.
Yeah.
The other is not having body dysmorphic disorder. Which kind of goes hand in hand with realistic expectations. Body dysmorphic disorder is when people see themselves differently in the mirror than everyone else sees themselves, which to a certain degree, everybody does that.
Yeah.
Everybody is harder on themselves than other people are hard on them. But, you definitely don't want that to be severe. Next would be somebody who's willing to follow instructions and be compliant. I believe me, over the years, I've had patients that have disregarded the instructions I give them post-op, and I'm very, very clear about what those instructions are. And I've had people that disregard them, and they end up having complications, which is not good for anyone. It's not good for me. It's not good for them. So you want to make sure that people are willing to follow instructions, because that is definitely key to having a good outcome.
Gotta have those rule followers.
Rule followers are good when you're having surgery. Patients that are well informed.
Yeah.
I love when I do a consult and patients ask a lot of questions, because it means they've done their homework. It means that they at least have some idea of what's going on. And I educate people. If people come in and they don't know anything, I educate them. But it's always better when people are well informed, because it shows that they're involved with their care.
Yes.
And people that are involved with their own care just tend to do better. So also, too, if they're well informed, they're more likely to pick the right surgeon. Mm-hmm. As we've talked about, picking a plastic surgeon could be a minefield.
And follow your procedures.
Yeah. Exactly. The next one is when the issues are not too extreme. Now, a lot of times you can't help this. I mean, there are patients out there that can't help that they've had a massive weight loss, or can't help that, they just have extreme amounts of extra skin after pregnancy or whatever. But if we're talking about the ideal patient, ideally you don't like to be on the extreme end away from where you want to be. Now, I operate on people who are on the extreme end all the time, but I do counsel those people like, look, you're really, really far away from where you want to be. It makes it a little bit harder to get that perfect result.
Yes.
So that's the other one. This is kind of one that a lot of people don't think about. Having plastic surgery for the right reasons, okay? And what I mean by like a wrong reason would be that someone else is pressuring them to have surgery.
Right.
So like the husband's pressuring the wife to get a boob job. And so one thing that really irks me is when like a husband and wife come in and do a consult and the guy's doing all the talking. I'm like, okay, the surgery is, she's the one having the surgery. Like, what do you think about this?
Yeah.
And granted, you don't see that very often, thankfully, but it does happen. And so, those people are more likely to be unhappy down the road because they're getting surgery not for their own reasons, but for someone else's.
Right.
People who are financially able to have surgery. Now, what do I mean by that? Well, one, avoiding medical tourism. Like, if you can't afford surgery, don't go overseas to do it because that's really
Right.
bad. Having the ability to take time off work, if you can't take a week or two off work to heal, then you're more likely to have complications. And then also having the ability to do follow-up surgeries if needed. Now, ideally, no one has a follow-up surgery, but in reality, when you're doing hundreds of surgeries every year, some people do. Some people might have, complications where they have to go back to surgery for whatever reason, or maybe they have like little minor stuff where they have to do touch-ups. Now, I try to do that stuff in the office when I can, but I can't always do that. And I personally don't charge people when they have to go back to surgery for any reason. Not all plastic surgeons are like that. In fact, a lot of plastic surgeons charge if they have a complication. I just don't. But you have to be able to go back to the OR. I remember one patient I had, and of course, I never know like people's financial situations, because I don't ask that kind of stuff. But I did surgery on a girl. She had kind of a complication that's kind of a known one for the surgery she was having. I was like, okay, well, we're going to go back and fix this. And it was a problem for her. She's like, I can't afford to go back to surgery, even though I wasn't charging her. She couldn't pay the OR fee. And eventually we sorted it out, but that was problematic.
Yeah.
Having a good support system.
Yeah.
That's
Having
important.
somebody to take care of you.
Yeah, this one's not critical, but like having a good support system of people to help take care of you in the recovery period can be nice.
My mommy took care of me after I had.
That's so nice. Do you have a good
Okay,
support
mine.
system?
Yeah.
Yeah. So if you don't, it doesn't mean you can't have surgery, but it does put you at a little more risk for having problems after the fact. People who do their own research. Now, this kind of goes around with being well informed, but I'm more talking specific about doing their own research about picking surgeons.
Yeah.
Instead of just, your friend telling you, hey, my plastic surgeon's good, go see that one, you go see that one. Like, do your research. Find out, do they have proper training? Do they have proper certification? Do they specialize in the areas that I'm, concerned in doing? And then finally, the last one is patients that don't want to do too much at one time.
Yeah.
The research clearly shows that when you have multiple surgeries at once, your risks go up. Now, I'll do a couple surgeries at once. That's generally my limit. But, you often hear stories, especially news stories of people who either died or had really bad outcomes where they were doing like 5 surgeries at once.
It's a lot of trauma.
Yeah, a lot of trauma. It's really stressful to your body. But yeah, I think a lot of people know some of these. You guys were able to pick out one pretty quickly, but a lot of these you don't think about. And so, if you're thinking about having plastic surgery, your friends having plastic surgery, then these top 10 things that make people a good candidate is good to know. So
Yeah, I think so.
All right, I just want to recap this last segment we did because I was making a top 10 list of what makes somebody a great plastic surgery candidate. And I base this on my 15 years of doing cosmetic surgery and plastic surgery in Dallas Metroplex. So first, overall being healthy, not being obese if possible, not smoking, not being diabetic. Next, having good mental health, not having body dysmorphic disorder, and also having realistic expectations. Being compliant, meaning you're willing to follow instructions. Patients who don't follow instructions are much more likely to have complications. Being well informed, when you're well informed about the procedures, it means that you are involved with your own care, and people who are involved with their own care tend to have better outcomes. Not having issues that are too extreme. Now, not everyone can help this. I do operate on people who have extreme issues, but I always tell people that it's much easier to get a perfect result when you're a little bit closer to that than on the extreme end. Doing surgery for the right reasons, which means doing plastic surgery for you and not for someone else. I hate when patients come in and they're being pressured by their husband or significant other to have plastic surgery. Being financially able to do it, and that means having the means to take time off work to recoup, and also having a little bit of funds in case you have to go back for surgery for any reason, which ideally never happens, but realistically does from time to time. Next is having a good support system, someone to help you during the recovery process. Next is patients who do their own research when picking a surgeon and not just going to someone they saw on social media or who their neighbor's sister's best friend had plastic surgery by. Do your research. Make sure the surgeon is properly trained, properly certified. And then finally, the best candidate doesn't want to do too much surgery at once. Research clearly shows that the more surgery you do at once, the more risk of complications. So, being reasonable how much surgery you want to have at once makes you a good candidate. And that's my top 10 list for great surgery, plastic surgery candidates.
Bam.
Bam! I think that's it. That was our third segment, right?
Yeah, I think
Man,
I did 5 out of 5 of those.
Oh, that's pretty good. I mean, that's not bad.
I was pretty ignorant whenever I got mine.
But you didn't have all that knowledge that you have now.
No, I didn't.
You're all knowledged up.
Yeah.
Like, if you were doing plastic surgery again, you would slay that.
Yeah, I would.
Boom. Slay it, Sarah. All right, everybody. Thank you guys so much for tuning in. We really do appreciate it. Please leave us a comment and let us know about what topics you might want to hear about on the next episode of Nip Talk. We're going to get out of here before this tornado gets. Look how dark it is out there. It's crazy.
My daughter Avery's freaking out over there.
Oh my God. All right. See you guys.